Why is melanoma so dangerous, Dr. Burke?
Melanoma can be lethal. And unlike other skin cancers, like the common basal cell carcinomas that just spread locally, melanoma can grow through your skin and spread through your body. 1 in 55 people in America will get a melanoma, and melanoma is the most common cancer in young adults. But as Martha said, the good thing is that we can see every melanoma when it's small. And if it's treated when it's small, it's almost 100% cured.
That's so great. That is so great. And Deborah, what prompted you to start the Melanoma Research Alliance?
Well, I have a story that I share with a lot of people because we're all at risk for melanoma. I want to mention that to you because people think that, oh, you know, she has blue eyes, light skin, but Bob Marley died of melanoma. I didn't know any of this, and I was seeing the head of dermatology at a major medical institution in New York, and I discovered I had stage 2 melanoma on the bottom of my foot.
Oh, wow.
When I went, because it was 4.2 centimeters, which is extremely large for melanoma especially, because small lesions can be extremely dangerous, I was told I had a 50% chance of it spreading. And when I said, well, okay, then what do you do? The doctors kind of looked at me, and I discovered to my horror that people with advanced stage melanoma, distant parts of their body, have less than a year to live.
Oh.
It's absolutely...
When was this? How many years ago?
4 years ago, in May, right now. And along with my husband, Leon, and Michael Milken, we're part of the Milken Institute, and like Milken, our goal is to do for melanoma what he has done for prostate cancer.
Indeed, and what an amazing accomplishment has occurred as a result of that foundation. And so why was so little research being done?
Well, I think unfortunately a lot of people view skin cancer as skin cancer light. They just don't appreciate how deadly, how virulent, and how truly devastating a disease it can be. As Dr. Burke has mentioned, caught early, and if one examines their own body and their family and...
But the bottom of your foot, what a weird place to get something.
Yes, but what people don't understand, and I feel like I'm constantly saying it, but I'll say it again because I think it can save lives. You can have melanoma in the obvious places. It can also be in your hair. It can be in your retina. It can be on the bottom of your foot.
Wow.
People of color tend to get it on their hands, the palms of their hands and their feet. But it really, truly can be in any part of the body that never sees sun. But happily, most are very, very catchable. And so that's why we're here.
Right. Now, I've read very horrific statistics, like only 15% survival of someone with an advanced stage.
Well, and even less survival at a more advanced stage.
Right. And how can you distinguish melanoma from regular skin cancer?
Well, it looks different. If we look at a melanoma, we have the so-called A, B, C, D, and E of melanoma. So a melanoma is asymmetric. If you look at one half and the other, it looks different on each side. The border is very irregular. It's serrated, it's not a smooth border of a normal mole. The color is mottled. There are many shades of color in the melanoma that you're looking at now. There's dark brown, light brown, shades of red, and even in the top center you can see shades of blue. So it's a very multiple colored lesion. By the time something becomes a melanoma, a cancer, it becomes larger. So if you have a mole that's larger or as large as the size of a pencil eraser, that's something that should be looked at. And finally, it evolves. So if you have a melanoma and it changes month by month, sometimes we dermatologists look at something and we're not so sure it's suspicious, but we take a very close-up photograph, and if we look at it 2 months later and it's different, it's highly suspicious. So the thing is, if you have something new and different on your body, have it checked
Checked
by a
out.
dermatologist.
And have it biopsied, not just checked if you feel at risk.
And so the risk factors of melanoma are?
The things that cause melanoma are hereditary and environmental. The biggest culprit is sun exposure. Tanning beds are absolutely dangerous. And if you use a tanning bed, you have about 4.4 times the chance of getting melanoma. And the people that use tanning beds are very often the most susceptible, the people with very light skin. And the hereditary susceptibility is if you have light skin, blue eyes, freckled complexion,
My hairdresser just told me, I said, where did you get your tan? Because I'm very suspicious. He had just gone to the tanning parlor.
Wow.
He better watch this.
But especially if you have lots of moles or have had an abnormal mole, and if you have a close family member, a parent or a sibling. And we also know just for sun exposure, if having had a blistering sunburn as a child doubles your chance of having a melanoma, and having 5 blistering sunburns throughout your life also doubles your chance of having a melanoma.
Pretty horrible.
Terrible.
Well, I have great news for our audience members. SkinCeuticals is sending you all home with SkinCeuticals Physical Fusion UV Defense SPF 50, which I use, and I have been using it for several years now, and it works beautifully. And the CE Ferulic antioxidant serum, which I just ran out of, and I am so happy because this is great too. What other things besides observing and sunscreen can we do to cover ourselves up?
Well, I think one of the most important things is taking antioxidants. And I recommend that everyone take about 1,000 of vitamin C every day, 400 of vitamin E, and selenium, which is a trace mineral. And if you take selenium, you almost can't get a blistering sunburn. And you can also apply antioxidants on the skin. And when you apply them directly on the skin, you can get levels of 27 times the amount of antioxidants on the surface of your skin where you need it and where it protects you. And the great thing is that applying a topical antioxidant on your skin and taking the antioxidants gives you protection all the time. Whereas a sunscreen, you must be applied every 90 minutes and very, very generously.
So Dr. Burke, can you explain what SunGuard does, because it's so phenomenal?
This is a fabulous product. Your usual golf shirt in the summer has an SPF of only about 4. But if you wash it with SunGuard, it gets an SPF of 30, which lasts 20 washes. So you should wash all of your sports clothes and your children's sports clothes in SunGuard, because now you have a protective factor of your clothes also. And you can buy protective clothes. You can buy, there's lots of catalogs of places to buy super protective hats with SPFs of 50. When you buy dark glasses, be sure that there is a label on them that says it blocks all UV. Because if not, your eyes dilate and you get a lot more damage from the sun with dark glasses that don't protect. Polarized glasses do not protect from UVB.
SunGuard is, again, generously giving everyone in the audience their SunGuard sun protection. So use this, wear gloves, sunglasses, a hat, all the kinds of things that we have to do. And Deborah, someone who has survived skin cancer, what advice do you have for people?
I would suggest strongly, even if you're a person that you don't think you're at risk, insist on you and your family, even children as young as 10 years old are getting melanoma, which is unheard of before recently. Go see a dermatologist at least once a year, twice if you're at high risk, but everyone should go. Also examine your own body, examine the body of those you love, your children, your partner, and make sure anything suspicious you bring to the attention of a dermatologist. And in my case, I regret not insisting on a biopsy, because you can avoid great drama and problems if you catch these skin lesions early.
Well, and Deborah and Dr. Burke, thank you very, very much for this very important information in a time, at the correct time of year too, because even though we've been rainy and cloudy and miserable, it's
Now the sun is
starting
coming out.
to get warm and sunny, and we have to take precautions.
But you should use sunblock all year round.
Oh, I do. And
Okay.
I think people know that now too,
Good.
Deborah. Yeah.